This is Ben Hudson with the Gender Health Center, and so what is the state of Pride as far as the Gender Health Center?
All right, well, so at the Gender Health Center, the primary direct service work that we do here is counseling. And the state of Pride with trans folks right now is that we need some help just to access regular services that other folks are having access to. So for us, that means competent mental health care, competent medical services, competent health care, and then actual access to that. And that means jobs, that means access to employment, right? That means access to proper identity documents. So what we're seeing happening is that while tolerance, as we call it, is moving along for GLB folks, the trans, as you aptly put, is really the caboose on this. So as we know, under Don't Ask, Don't Tell, trans folks were not included in that kind of protection. As we know, things like ENDA in 2007 left out trans folks, and we're still waiting on that. There still tends to be the big movement in our community is gay marriage, and as we know, that movement is happening. It's all going to be here, hopefully, before any of us leave this earth. So we're going to see this happening. So we need to refocus on health and human services and understand that trans folks are actually the ones that have already provided inlets into all of these roads. We are the ones out there on the front lines training our health professionals about these things. But unfortunately, it also means that if we can't get access to our health care, then we can't get access to our employment, we can't get access to money, we can't get access to having any sort of piece of this pie that's out here. And so trans folks who come from all spectrums, come from every blue and red state, every religious background, everything that you can imagine, are being denied these rights, and every ethnic background, and we're really struggling in those areas continually. But what we are seeing with agencies like ours is that there's a lot of grassroots movement on there. There's a lot of hope still out there. There's a lot of places like this who are willing to be an entire volunteer organization, so that over 400 clients within 2 years have been able to have access to these services, able to attain the things they need. I'm seeing folks going back to school, getting jobs, opening up businesses, working in the government, living in their own one-bedroom apartments, and not getting involved in unhealthy relationships. So we're seeing it happen, but we're not getting the support from other folks to even support organizations like ours. So this is the state as I'm seeing it, and as you may know, I'm what I call queer spawn. So I was born and raised in this community to a lesbian mother and a gay father. So I've been doing this for almost 35 years, and I'm seeing a little bit of movement, but I'm still seeing that same indifference and ignoring of a community that's out there. And we need some more cohesion in order to move forward.
Yeah.
And that's what I think the state of Pride is at the moment.
So as you're talking about that, one of the things, could you describe a little bit some of the barriers that some of your clients who walk in the door have run into? Nothing really specific, identifiable, but just some examples.
So some of the barriers that folks are running into are just plain discrimination. So we're having problems with folks, getting past the door into an interview, no matter what your resume looks like, no matter, the experience that you've been having. And when that kind of systematic discrimination happens, sometimes then the barrier for that trans folk is even walking into that agency. The depression is a huge overlay. Depression and anxiety is a huge problem within our communities because folks are being systematically discriminated everywhere that they go. So we're seeing a lot of employment disparities. The economic disparities are great within our community. We're seeing folks just trying to get access to the health care that they already pay for. So someone's parents have insurance, they have insurance through their job, any of these things, and they're not getting the same kind of health care that they're entitled to because their insurance doesn't cover anything trans-related, whereas they would cover that type of hormones or any of those things for someone who was born into the gender that they live. And that's very, very frustrating for folks not being entitled to that stuff. And when you don't have your basic needs met, your housing, your health, your employment, food in your belly, then you're not giving back to the communities that you live in. And these are the barriers that we're seeing day in and day out.
What would you say to cisgendered people who say that it doesn't matter, just be yourself, just be who you are, don't tell them of your past and everything will be okay?
I think that just breeds more intolerance. That just says, go back in the closet. We work so hard to come out of a closet and be who we are and be our authentic selves, and they want us to hide. I'm a product of my experience, and when folks look at me and think that I'm just some, fat white guy, that they see it before, that's not my experience in life. I'm much different from someone who resembles me in that way, and I need to be able to share that. This is what's going to change the way that people think about trans folks. Their point is to say, just don't worry about it. Pretend you aren't who you are and you can be accepted, but they aren't creating a society that is accepting of those individuals. And it's only those of us who are on the border and pushing that a little bit more and being out about our status, even if we are passable, that are pushing that envelope. So forget that. I'm proud to say that I lived as a lesbian, that I went to the National Women's Conference with Betty Friedan in 1999. I'm proud to say who I am and who I was born to, and I certainly hope that we can create an environment where trans folks can be a product of their experience and are allowed that as individuals without all the assumptions.
One last question that I can think of, and then I'll ask the last question. I was really happy with what the Girl Scouts did this year. Did you buy way too many cookies too?
So, unfortunately for me, there's so many cross-movement stuff that when it comes to food, I don't really support all the distributors of the cookies, right? But I definitely support the Girl Scouts. And as a person who was raised by a lesbian mom who was my Girl Scout leader, I very much support that. I very much support that what's happening is that trans youth who are coming around more and more and more, 3 years old, 5 years old, 7 years old, 10 years old, they are an inlet into the trans community in a way that society has never seen before. So the acceptance and the movement within people's hearts about trans youth wanting to live their authentic selves is coming more and more in the forefront. And with an organization like Girl Scouts coming forward and saying we accept all girls, that is huge for our movement. And it's exciting for me as a former Girl Scout.
Okay, and then the famous reporter's last question. Is there anything that we didn't cover that you thought about that you'd like to get in this last round?
I can only, I just want to encourage people to have courage, as I let people know, to know that, one of the things that I do every day in my life is I wake up and I have the courage to face most of my fears in that day, and that is what you need to do to be able to succeed and face the things that are the most uncomfortable and the most scary in your life. And if you let people in your workplace, family members, people in your apartment building, if you let them keep you down and keep you from being your authentic self, the person who you live to be if you're a trans person, then you're giving in. You've really lost the fight after you already won.
Yeah.